are welcome. Welcome to learn. Welcome to participate. Welcome to join a private discussion about knee surgery recovery and rehab. R&R, Knee Surgery Recovery and Rehab, a private discussion group on Facebook. Search Facebook groups for knee replacement recovery and look for the beach. You are welcome.
Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
So let's do this. We're going to go through, I think, 3 little parts to this podcast. It's just going to be Mary and me today. But we are going to start with looking back on some of the good stories from this past year, and you can go back and listen to those stories individually if you choose. We'll then talk about the inception of the podcast a little bit more, and then finally we want to talk about tools for 2020. In fact, this podcast lives on a web page that has 9 very specific tools to use for those who are going forward in 2020, this coming year, this year that we're all in now, because you're probably going to be listening to this in 2020, although we are recording this right before Christmas, so it's a little bit of a holiday spirit, but we're going to go through that as well. So welcome to the Bee's Knees podcast. This is PJ. This is a unique thing, Mary. We're together. It's not like we're ships passing in the night. We're actually on the same call.
I know. It's fabulous, actually. Very nice.
How did it take a year for us to be on the same line talking about knees and patients? Isn't that amazing?
It is amazing. And you know what? It's amazing what you've created here. What a great venue, do I want to call it that you've created. I know I've gotten a lot of feedback from all our patients that when they were struggling and in a harsh moment and wanting to give up, that they would put on one of our podcasts and listen to an inspirational story about, that same person on the other end is, feeling the same pain that they were feeling, and they were inspired by them and kept moving forward and got out of that harsh moment and made progress and got their life back. So you're creating a lot of good with this. It's quite beautiful.
It is great. It's something like feeling you're part of a community, I think, because there are people, and you may never meet them, but you hear their voices, and they're all over the world, all over the country, everywhere that people are going through this surgery, and it isn't easy. It's painful. It's got a big recovery time window that you need to approach properly, and there's stuff that you need to do beforehand to prepare. Decisions to be made. In some cases, people decided to go for 2 knees instead of 1 along the way. And all of that, I think, comes from listening to lots of voices, and this podcast really provides that. We started with the blog a few years ago, the meta blog, and this was sort of a natural extension from that, becoming a verbal audio version of the blog in a lot of ways. And it's changed the way the blog works too. I think we're not just focusing on, very specific stories related to the X10 knee machine. We're now much broader. I think we're a lot better because of the podcast, really.
Well, it makes it more personal, right? Because when you're making these decisions about your beautiful body, the only one you have, right? Without it, you have nothing. And, hearing people talk and say the words that they say about their recovery and their belief systems and how they conquered an obstacle, it gets real personal, and that's quite beautiful. And, you have to be vulnerable in order to get into that space. And when you're vulnerable, a lot of good things. When you allow yourself to be vulnerable, a lot of beauty comes out of that. So we've been blessed with many people who have shared their vulnerabilities with us and did it quite well.
You're really good at that too, in terms of getting people to speak. I guess let's start with part 1, and that is, Mary, the patients, the stories that we did this past year that you remember well. Anything strike you to start?
Sure. For instance, I interviewed a wonderful gentleman, Jeff, who was really struggling in getting his flexion. And he was concerned, and he searched and searched out there and found the X10, and he went against his surgeon's desires for him as far as recovery goes. And he rented the X10, paid out of pocket for it, and continued to go to outpatient physical therapy, not telling them either that he was using the X10. I mean, you want to talk about somebody who's got a lot of faith in his own decision making, right? And boy, did the outcome of that come out very well for him. He was so happy that he made the choices that he made. And here again, that teaches us, you know what? You've got to be your own advocate. If you firmly believe in something, and if something isn't working out for you, here again, you need to take matters into your own hands. It's your body. You have the final say of what happens with it and how. So remember that, right? Use your courage, right? Use your determination and move forward on a path that feels right to you. And Jeff really explicitly explains how he did that. And I thought he really had a strong message to convey to all our listeners.
Mary, regarding Jeff, there was another patient that also took the recovery in her own hands, and that's Donna from North Carolina. And in her case, through interaction with me and then through our bilateral group on Facebook, she decided to go for 2 knees instead of 1. And that was a very big decision, and it involved her changing surgeons along the way, if you can imagine. And this was 2 weeks before the surgery, a week before the surgery. She put her foot down and said, no, you know what, guess what? I'm going to do 2 knees. And the surgeon's assistant, the physician's assistant said, well, we don't do that. Our doctor doesn't do that. And she said, okay, give me another doctor, which I thought was just unbelievable. And she did. She got a different surgeon from the same practice. They moved quickly. Within minutes, I think they were rescheduling her not to lose her business. And indeed, it was delayed a week and a half, 2 weeks, and she ended up doing 2 knees at once and never regretted it at all. In fact, she was pretty much done with her recovery, 3 weeks, almost 4 post-surgery, feeling like a champion and looking at divine intervention to have guided her, really, with her faith to go for 2. And now she's a happy lady. This Christmas season, she's great. And it was all because she looked out for her own recovery very specifically. And let me add one more, just on that same theme of your Jeff and then Donna. This morning, I was actually editing the words of Rita DeMontis. Remember the lady from Toronto, the writer? Do you remember her?
Yes, absolutely.
Wasn't that great? Well,
yes.
she's going to be part of the book that's coming up that I'm working on, right, where there are a collection of some of these stories. And she and I spoke a week and a half ago, and I was going through her words today. And she had scheduled surgery, canceled it twice, 2 times.
Wow.
Over the course of 16 months or so, because A, she felt she was too heavy, B, she didn't feel like she was mentally ready. She had all kinds of things that got in the way, and it was fear. And she speaks very openly about it. It's going to be a really terrific chapter, and it's a great recording that people can go back and listen to, Rita DeMontis. She did not use the X10 machine, mind you, but she did bilateral knee replacement in Toronto, found a great practice, a great surgeon, a great hospital setting, and got back to her very, very active, awesome life as a food editor, the national food editor for a national chain of newspapers in Canada. But she openly talks about having some moments where A, she was in great pain, B, she was compromised, she could not move, she couldn't go to the grocery store, and then C, saying, I need help. I have to face my challenges. I've got to lose this weight. I've got to get mentally ready. I've got to eat healthier. And she did a whole big program with a friend acting as a trainer, getting her in shape for her surgery, which then went extremely well, a lot because she planned so well and did all that work and lost weight and all that good stuff. So it was, again, she had to take charge because they were ready to go, right? Okay, we're getting you scheduled. And she was literally in tears saying that I can't do it. I'm not ready. You got to give me some more time. It was quite a dramatic story, actually.
Very inspiring story. That's what I'm talking about. When people share their deepest, harshest moments, it does help us, right? We learn from each other, and this is just a great platform to do that within. So thank you, PJ, for creating that. I'm sure everybody out there is really appreciating it.
Yeah, I think so. I mean, I think the audience is still relatively small for what we're doing, But I think our effort this year has been to stray from, hey, everybody, you need to learn the X10 machine, it's going to be great, to there are lots of ways to get well. We introduced a few names and a few personalities to the podcast, Michelle Stiles, Marie Buckner, Bill Paravano. All of them are just people in the world of knee recovery, physical therapists and people who have created websites and personal trainers and with unique philosophies on recovery. And I think there's value in going back to some of those interviews for people to see that, yes, there's this great device and we're part of the X10 company and we're doing all this great work, truly great work. But there are resources out there that are beyond what you and I do, Mary, that are pretty useful. And we've started to introduce those voices to this podcast. And I'm very proud of that. We've got more coming too early next year, trying to just provide as much support to people listening to this podcast as possible. And, I don't know who some of the voices that we'll hear next year in 2020 will be, but I'm excited to find out.
Me too. Me too, for sure. Absolutely. Well, we're creating a lot of value, right? We're educating. Sometimes, you don't realize you don't know what you don't know, right? You don't know what you don't know. And then you'll hear somebody's story and experience, and you're like, wow, I didn't even think about that. I better look into that, right? So we're here to broaden your mind and help you so that you can make the best decisions, right, for you. So it's beautiful. It's all good.
Yeah.
All good here.
I agree.
Yep.
I agree. It's a journey, and I think it's a journey for you. And I mentioned earlier, it's a journey for me, both of us, of course. But you mentioned dropping your guard, I think, in some sense, and being vulnerable. And you are much better than I am at doing that, mind you.
It's because I've had more practice. I had more practice.
My guard's up, Mary. I don't know what's wrong. But you are really good at that, and you hear it in the interviews. I mean, who was the gentleman? Oh, do you remember the extreme pain gentleman from Michigan?
Yeah.
Do you remember his name?
Tom, your dad's accountant's friend, right?
Yeah. Tom Jurowitz.
Yes.
Tom
Oh
Jurowitz.
gosh.
Do you want to talk about him?
Yes. Let's talk about. Let's talk about pain first of all, right? Pain is a huge issue with knee replacement, and a lot of times we see patients walking into knee replacement, no one educating them that this is quite painful. The recovery can be quite painful, and then all of a sudden they come out of surgery, they get home, the pain meds, pain pumps wear off, and all of a sudden these poor patients are thrown into a situation they weren't prepared for, right? That's tough. Well, we have interviewed, PJ and I both, some amazing patients who really told us their story. Here's men who have been athletes their whole lives. They've been acquainted with pain in their past, but yet the pain of knee recovery shut them down into such a negative, fear-filled mode that, they were so despondent that they wanted to share that with us so they could build awareness within all of you so that you could better prepare yourself and not go through what they went through, right? And not be consumed with doubt and lose your faith that, oh my God, why did I have this surgery? God, I'm worse off than I was before surgery. Those are those dark moments that they had to move through. And we had a great story. Tom shared that with us. Here again, athlete, strong man, right? Strong character. But yet this almost put him down, right? The fear of not being able to bend his leg and the pain involved with that. He needs support, and he needed to reach out, and he did. He chose to open up to all of us who were coaching him and sharing his fears, right? That's a huge thing. To be vulnerable like that, it takes courage, A, to ask for help, B, to feel weak, and yet talk about it with another human being, right? Especially somebody you just met. So we've had a lot of courageous moments here on this podcast and a lot of patients sharing that with us. And then we had wonderful Jick from Toronto. He's a professor at the University of Toronto who came to Michigan and rented a hotel room because he was despondent too. He couldn't get past a certain point on his flexion, and he was in trouble, right? He wanted his life back, and there were no other solutions for him. And Jick, what he did is he described pain in a whole new way. Now, PJ and I have been dealing with the X10 and pain and people speaking about pain, but Jick put it in a whole different perspective on how, the X10 digitalized his pain. So that way he could look at it digitally and decide what his pain threshold was and experiment with it. Now, that's a whole new take on something that PJ and I breathe day in, day out, and I've never looked at it from that perspective. So, there's value into listening to others and what they encounter in a situation, especially when you're going through it, right? It can teach you a lot, right? Teach you a lot.
If you want to go back and listen to those, Tom Jurowitz is his name, was in August 24th version of our podcast episode. And then Jick Chen, Dr. Chen, was 11/29. And those are both stories of men who were dealing with pain and dealing with recovery. Jick, of course, recovering, looking at it from a scientific perspective. That's his business. And then Tom was just so open. I remember walking last summer, listening to that before we published it, your interview with Tom. I was walking in Lower Manhattan, on a sunny Saturday morning, listening to it. And I just couldn't believe, again, how open and how giving he was to you. And I was just thinking, if I were on that interview, it would be very different. But I think you just got a lot out of that chat. And if you look about vulnerability and overcoming obstacles, there's a good example there, I think, in Tom, and also with Dr. Chen. Pretty good stuff.
Well, I think the desire to pay it forward overrode, being closed off to expressing what was really going on with them, right? Mm-hmm. When you have a situation like that, I think the desire is so strong with actually every one of the people that we interview, PJ and I. That's all that's voluntarily. And I'm going to tell you something, PJ. Last week I had a wonderful woman. I brought her into our office. She is trying to avoid a manipulation under anesthesia, and she's struggling, right? And she's really scared because her bend is at 83 degrees. Okay, that gets her nowhere. She cannot live a normal life, and she's young too. She's not an older woman; she's young. And what she said with me, because I was giving her a little inspirational speech, if you want to call it that, when I spoke to her, because she's renting the X10, and I really wanted to make sure, I know that healing, and too, PJ, and everybody who's listening out there, healing isn't just the physical part of it, right? You have to make sure your mind is where it needs to be, right? Your heart is where it needs to be. You have to have faith in what you're doing in order to accomplish what you want. And so I'm on the phone with her trying to pump her up before that X10 is delivered to her. You know what she said to me? I was so excited. She said to me, "Mary, you don't have to, I appreciate the pep talk." She said, "but you don't have to worry about me, because you know what? When this is all done and over with, you're going to be interviewing me on that podcast. My story is going to be so great, and I'm going to want to share that with everyone." So, how beautiful is that? Right? How beautiful is that? Isn't that great?
Well, this thing takes on a life of its own, this little podcast, and it is inspiring people. And I'm increasingly speaking with people. Yeah, I listen to you, listen to Mary. I want to be like her or him. I mean, it's really, it's amazing. You put something out there, and then it starts to develop on its own, and I think that's what we've seen here.
Well, things are more believable when someone like you is experiencing it, and then they share their story, and they pave the road for you, right? They give you a roadmap to follow. Then now you have words of wisdom from someone you trust and can relate to, and you also have a path to follow. It's been laid out for you. How beautiful is that we help one another, right? That's what life's all about, us reaching out to one another and helping one another and using our gifts and talents to do good, right? And especially during Christmas, for goodness sakes. It's a great time of year to be having this conversation with you, PJ. Perfect.
Mm-hmm. Well, again, we talked a little bit about, let's move on to that other part 2 of our little chat, which is, I think, why we did it. And I'll dive in, which is, I think there's a lack of believability, A, about what we do with this machine and this program, and B, about anything that you don't hear from your surgeon. And so with the X10, I've heard repeatedly, I don't believe it. Tell me, where's the research? It seems too good to be true. And I focus on those words, too good to be true, because it looks too good to be true. It isn't magic. You and I know that. It's a tremendous amount of work on the part of the patient. It's not always easy. There are obstacles along the way. It's a device, for goodness sake, and we've wrapped around that device a program. In this case, it really works, but I think there's a justified amount of skepticism out there about something that did not come from the hospital or the surgeon. And it's our job to help communicate the virtues, value of this device before it's covered broadly and is in every hospital and in every clinic across the country. And, that's what we're doing with this podcast and the blogging. And the reason that I built this, I decided one summer morning, hey, we need a podcast, and it was just about like that, was the fact that short form, quick little 90-second testimonials, I don't think cut it anymore. There's all kinds of ways to fake stuff out there and falsify. And I just don't think that a little short version of an interview, when we do an interview, it's an hour, and we might distill it down to 90 to 120 seconds of video. Well, that's the sales pitch. I want to hear the full story, and that's what you have done and I have done with these longer form interviews that we share unedited, unvarnished. We share in their complete form. Suddenly, you don't need to trust Mary or PJ or anybody at X10. You can just listen to the person, the actual patient, talk about their recovery, if you're willing. I mean, I think, Mary, not everybody really wants to listen to an hour of our conversations. I've got a feeling, right? But it's there if you want it, right?
Well, and you know what? Now with these podcasts, it's brilliant because you can just listen on your way to work, right? You've got a long drive somewhere. Boy, how convenient are these podcasts? What a great platform to be able to do good within. Love it. I absolutely love it.
It's evolved while we've been doing this. It's now the hottest thing. Everyone's talking about it. Every star's got a podcast. I mean, it's exploded since we started, and we were by no means early in the game. But since we began, a year and a half ago, this thing has turned into this medium. It's just, it's crazy what's going on. There's one more thing, and then we should get to our 2020 conversation and the tools that we've created. But there's one more thing I did want to remark on, and it was something that we did last year. There were 5 parts to it, and it began in the spring, and then it kind of went right through the summer. And that, well, actually, it probably began in the winter and went through the spring. But those were threats to a proper knee replacement recovery. And in the end, there were 5 different podcasts, and there were 5 different blogs that accompanied them. And they go hand in hand because a lot of the resources that you listen to on one of these episodes, actually, you want to read and you want to go follow the links. But they were these 5 threats that were created: lack of knee flexion, lack of full knee extension, deep vein thrombosis, so blood clots, DVTs, knee infection, and protective muscle guarding. There are others, and I will write those. I will get to those, but these 5 were published in 2019. I think they're evergreen. They will live, and they may be updated a little bit as time goes by, but they really stand tall in my mind of assets, valuable tools that have no objective to do anything but help. There's no veiled sales pitch for the X10. It's just pure research and information for people to avoid some of those challenges, those obstacles to a good recovery. Do you remember that series?
Are you kidding? They're fantastic. I am so glad you put them out there. But I'm going to say something. PJ and I wouldn't do what we are currently doing if we didn't believe 150% in what we're doing. We work for X10 and we represent it because we know it works. So just please remember that, everybody out there. I mean, I have a strong character, so does PJ. I mean, I wouldn't be wasting my time here with this if I didn't truly believe and see the results that machine offers. So, I mean, you have options now, and that's what we're trying to broadcast to you. It's not the same old that's been going on for the last 40 to 50 years. Heck no. You have options that can make your recovery a heck of a lot easier, a heck of a lot better, and give the results not only that you want, but that you need to have a good, high-quality life. So, we're trying to cover many facets within this. PJ has, God, brought so much value that he and now I have to offer you as far as information, so that way you can ensure as best as possible you have a great recovery. So just know our heart is totally in this. I know mine is. I know PJ's is too, and actually our whole staff. We are a very loving, caring staff, and we are so happy that we've been brought together with all of you. Honestly, we really are here to do good work. So just know that.
I'm glad you brought that up. Actually, we don't have everyone on these podcasts. We've had a few of our fellow coworkers, but a lot of folks will never end up here on this broadcast. But they are there, and if you were to go person by person, you'd see that same love and care
Heart.
and hope and heart. Yeah, it's really there, and I'm glad you brought that up, because I was in a chat the other day on one of our private groups on Facebook. I think it was maybe the bilateral group, and someone said, "Are you with X10? Or I seem to see a lot of X10 information here, and is this a sales pitch?" And I felt so defensive and so sensitive about that topic, because I want to. It's such a great thing that we have that I do want to tell you about the X10. I do, but I don't want to sell you. I want to help you. I'm here. This is not a forum. This bilateral knee replacement recovery group is not a forum for us to push X10 on everybody. But yet you can't avoid that this is this remarkable tool. So I think you and I are caught in between sometimes. We have this secret, magical, awesome sauce that we can offer, but we don't want to. People sometimes have to come to it themselves, or they need to get their surgeon involved, or a good counselor, a physical therapist they trust to help advise them to go in the direction of this machine versus listen to some of the things that we're trying to share. So it's a funny thing, being in between counseling and sales, I think.
Right. It is, but it's beautiful. I love it, and I know you do too.
Yeah. All right.
Our intentions are good.
Yes. Right. Exactly. I guess at the bottom line, that's it. All right. So you are listening to this. It's probably 2020. You're listening to us look back. Let's look forward to this year. And there is, on December 20th, there was published a beautiful article, blog, as well as this podcast. And if you go on this page that we're talking about right now, you will see tools that we've put together for anyone going forward with a total knee replacement or partial knee replacement in 2020. And so you can go back to this episode page. You can just go to the blog on x10therapy.com and find the December 20th edition of either, and you'll see these 9 tools that we've created over the last year that we're bundling together. Let's go through them one by one, Mary, and we'll bring this thing home after that. What do you think?
That sounds great.
Okay, good.
That sounds great.
Good. So this really is targeted to those who are going to have a surgery in 2020. Okay, that's what we're talking about now. So that's not you, have a great day. But if it is you, keep listening, and we'll take you through them very quickly, and then you can review them and use these tools as you need to. So the first thing we've got are online knee assessments. Okay, should you have a knee replacement at all? And this was taken from an Oxford test that was created. We've adapted that. But the idea is, what's going on with you? Let's take a quiz, and let's find out if you, by this quiz's estimate, should be considering a knee replacement. And the idea is not to be a definitive answer to that question, but to be more information for you. Ask a bunch of questions that you need to consider yourself, and then have a bit of an evaluation. It's instant. It comes right to you instantly from that tool. And then you've got, maybe the cause to say, I should visit or find an orthopedic surgeon. It's I should at least take the meeting and see if they think that I need to have a knee replacement, because based upon this tool, this online, very, very interesting tool, the tool suggests that I should have that conversation, or suggests that, nope, I don't need one. I'm probably still okay as I am. So that's the first one on the list. Mary, the second one is this questions to ask your surgeon. Do you remember that one that we did last year?
Yes, I do. Absolutely.
Big long list, isn't it?
Mm-hmm.
And the whole point here is, if you haven't selected a surgeon or you're shopping for surgeons, which a lot of people do, I highly encourage that you walk in armed. You go in with a list of things to go over. And there are questions that you're not going to think about on your own. I'm telling you that right now. If you take a look at this, you print it out, there's a question about recovery, a lot of questions about recovery that you need to address. What is the plan? Do you send me to a facility? Do you believe in that device, the CPM, which no longer works and never worked? And you need to know a lot about that, because they may, as part of their protocol, put you on a device that is ineffective. What's your pain management program? And also, you want to talk about your own medical history in real detail, because, for instance, how many people have we run into, Mary, who had an allergy, had to have a revision, and they were allergic to the metal, and it was found out after the surgery, for goodness sake.
That's right. That's right.
Right? There's stuff you've got to look
absolutely.
out for.
Absolutely. And that, there's more to it than that. Please be mindful, everybody out there. Know who you are, right? Because when you know who you are, you can make really great decisions for yourself. And part of that is if you know what you want and why you want it, and what you want your life to look like after this surgery is done and your recovery is over, you're going to be able to make a better decision. And you may visit a surgeon who has his own opinions for you. And I'm going to tell you something. I hear this often from our younger population of patients. Mary, I kept seeing the same orthopedic surgeon, and he wanted, and their intentions are good. I'm not saying that they're not by any means, but they want the patients to sometimes in the surgeon's minds, hey, you better put off this surgery because the implant's only going to last so long. And quite a few of our patients have found out that, they would go see a different surgeon because they weren't happy with that answer, because their thought process, now I'm talking about the patient, is, hey, yeah, great that the implant will only last so long, but at what point do I want to, how long do I want to wait and sacrifice my quality of life so that way I can have better knees when I'm 90? Who cares about what's happening when I'm 90? I'm moving now. I'm active now, and I run, or I'm athletic, and I don't want to lose these years where I can move and still have the desire to. I want to move now. And they have seen other surgeons and gotten a different answer, like, hey, no, I agree with you. Let's replace these knees now. Let's not wait any longer. And I even had one patient that his wife said, oh my God, and he actually started crying when he shared this story with me. I did a podcast with him, that his wife said to him, oh my God, Ron, I was so used to you seeing you with a scrunched up face because of the pain, because he was very active. He remained active even though he had the pain that he was dealing with all day long with his knees. And she said, I haven't seen your face without that scrunched up look on it in years. It's so good to see your face look peaceful again. And that's because he had his knees replaced. So yeah, ask those questions. PJ's right. Ask those questions, but make sure you know who you are and what you want, and make sure you get it. Okay, go after that.
You're right. Who you are, what you're trying to accomplish. Is this the right surgeon? Is this the right surgery? We're providing research insight in number 3 on our list, the knee library. And, we're discovering things as researchers are, and we're sharing those with people. And that's one of my favorite tools that we've created. It's on this
God,
list. Right?
It's a great tool. Oh, my goodness, PJ. Fantastic. Honestly, you all want to take a peek in there and go through it. Take your time, because PJ's placed an incredible amount of valuable information in there for you.
And that's one that is refreshed on an ongoing basis every couple of weeks with new research. There's some great video. Some of it's graphic, and it notes that first, so you may or may not want to watch a real surgery being done. But I remember one that recall one that we just published within the last 4 weeks, and that is, if you have a partial and then you convert to a total, what are the success rates? Is that a good thing? Is that a bad thing? And in fact, there are real problems with a need for revision when you do convert from partial to full, to total. And that's a concern. It's something that you need to take into consideration. If the doctor says, only 1/3 of your knee, one little part needs to be done, let's just do that for now, and it's less trouble, less invasive. And then, if you need one later, we'll do the whole thing again. And it turns out, that's an okay decision to make, but you need to know that there are risks attached to even that. Anytime you go back in and do adjustments, it can cause problems. And there was a very illuminating research study that I saw recently about that I placed in that library. So that's just an ongoing list of outbound links to places that allow you to explore different issues further. And it's not just about knee replacement. It goes into all kinds of different ligament work, patellar fractures, prehab, rehab, alternatives to surgery. So it's a sort of a wealth of information that's just
incredibly valuable. Right, incredibly valuable.
Yeah, I love that one. All right, number 4 on our list is the email series. We have created a number of email series, but this email series is indeed prehab and preparation. And in this case, you enter in some information, right? You are going to say what is the name of your surgeon, what's the date, and that just allows us to customize the emails a little bit more. It's not like we're doing anything with that information, but it actually customizes a 6-week prehab program for you that moves you all the way from surgeries far away to the day before, with holding your hand along the way with good counsel, good advice from surgeons and therapists and a whole bunch of other medical professionals, some patient stories. Again, not here to sell you on our device, mind you. This is not about the X10. It's a prehab and pre-surgery program that lives on its own for anybody anywhere in the world. And it's an email series that's free that you can sign up for, again, on this episode webpage. So that's our 4th entry. Okay, we have a great video. Yvonne Lacrosse used to work with us. Remember her video work?
Absolutely, absolutely. This is a very, very good video. Everyone should watch it, for sure.
Yeah, it's one of those it's quick. And there are 3 parts to her very well-organized piece, which is prepare your body, prepare your home, and make a plan. And it's practical advice. She just talks, right? She goes for 10 minutes without pause. It's amazing. She just takes it through it, which I think is pretty awesome.
Yeah, she shares a wealth of knowledge for all of you out there. I highly recommend it too. It's
a good one.
Worth your time to watch it.
Yeah, it's funny. Okay, number 6, we're getting into the home stretch here. What about going for 2? I referenced Donna a couple times in this podcast, but Donna in North Carolina did go for 2. It's just nice to hear a full, successful, smart story of recovery, and you'll hear Donna's evolution from going for 1 to going for 2 and all the things that went along with that. So that's just a patient story, but I did include one recovery story in this list just so you can go and listen to a patient. I think listening to lots of them is a good idea, but that's a good one. And then number 7, getting a dialogue with real people who've already gone before. Not just listening to one of Mary's beautiful podcasts, but actually getting in there and saying, all right, I've got a list of questions, everybody, let's get going. And one great place to do that is on Facebook in a private, mind you, discussion, dialogue, discussion group, chat group that you can join. It's called Knee Surgery, Recovery, and Rehab. Just under 1,000 people are there, very active, there to help. They've already done this, most of them, and they're there to help. So, I think those groups are incredibly valuable. You're in that group, I think, Mary, aren't you?
Absolutely. And that, now talk about having somebody who's going through what you're going through, and you can talk to them about it. How valuable is that? They even get on there. I see even in the middle of the night, if they can't sleep and they want to have somebody to talk to. Great, another place to be able to reach out and get help. Very beautiful.
Yeah. With all of the trappings that go with Facebook, and I know a lot of people are not on Facebook, and privacy is a problem, and we're all up in arms at this point about Facebook and social media. This is a safe space where you can explore. No one's advertising anything to you. It's just a safe little environment with people that, believe it or not, become your friends over time. And
that's right.
Everyone says, I love this group. They're all so helpful. Thank you. All that's going on all the time, and it's just a very good little community. Right.
It's a great way to get support, and everybody needs support, so be kind to you. Make sure you take advantage of that.
Yeah. Number 8, assess your knee condition early and often, it says, and I agree agree with
Love
that.
this, Leah.
Right?
Love this.
These are
Great
tools.
tool.
Yeah, I mean, these are things you do now, today. Go there and start getting assessments. You can get all the answers you need online. You just do them at home. There are various instructions and videos, and you'd say, okay, how's my flexion? How's my extension? What's my 6-minute walking drill look like? Can I stand on one foot? What's my balance? A whole bunch of assessments that you can do that I slaved over, mind you, for weeks in August.
You
My
did a
God, I
great
remember
job with it.
that. Yeah,
Oh,
that
they're
was,
great. Honestly, very helpful, very valuable.
yeah.
Great job.
Thank you, thank you. I really love these. I don't think they're being used enough at all. They're just there to help you, and I think that you can do them before, right after, or soon after your surgery. Many of them, not all, and then 6 months, 8 months, 3 months. I mean, a whole bunch of uses of these time frames that you can use these tools from before, after, and then way after your surgery to see, assess your knee condition and to see if your left is as good as your right knee and are they both progressing and what was your baseline. And there's just a lot of great info that you can do through those tools. So there are a whole bunch of them. Some of them are bundled. I do actually have a 3-month and a 6-month assessment all kind of bundled together in addition to these individual tools. But that's something you can do right now and get just a sense of how you are in a little bit in comparison to people that are like you.
And how valuable? How can you move forward in a goal, right, and progress if you don't know where you're currently at? You have to know where you're currently at, right? So that way you know where you need to go. So take advantage of those tools. They're very valuable for you and will keep you moving and progressing in the direction you need to go in.
Mary, number 9 is listen to the Bee's Knees podcast.
Well, I totally believe in that one. Yeah, there you go.
This is a circular loop.
Stuff.
You're listening to it, and we're asking you to listen to it. I'm not sure that makes as much logic now that I look at it as I originally thought.
That's true, but you know what? That's all right. We'll close with that.
Right.
That's very valuable, right? You guys know that you're listening, right? We'll give you a lot of. We really care about you out there, and we're really working hard on really making your knee questions and knee recovery, everything better than you ever imagined it to be. We want your recovery and your whole experience to be better than even what you've imagined it to be.
So nicely said. There is one little note at the bottom of this page, and I'll leave you with that on this topic, and that is, call us. We're not here to sell you on anything. Just call us.
That's right.
Talk to me, talk to Mary, talk to Brian, talk to one of our clinicians. We've got a whole team that are there to just answer questions, just talk to you about what you're going through. There are a lot of tools that have nothing to do with our company that you can consider to explore: stationary bikes and stretching regimens, a whole bunch of stuff. Let's just leave it at that we've got at our disposal. And a 15-minute phone call can be worth its weight in gold just to know somebody's out there thinking about you. And we are certainly, we want to play that role for you, fulfill that for you. All right, Mary. Wow,
Absolutely.
We did a lot of good work.
Absolutely.
Here.
That's right. That's
it's
right.
Weird,
we're here
though.
to help.
We can't say Merry Christmas. We should, I guess, in general, but we can't because it's not. People are listening to this whenever, and we're not going to say Happy New Year because people are now listening to this in February or March.
You know what we can say?
What can we say?
We can say? We can say this. You know what? Just know that PJ and I are here and doing this just because we really want you to have a great experience and a great recovery. We want it to be everything you're dreaming of and more. So we're going to keep putting out information out there that will benefit you, that will educate you, so you can move forward making the best decisions possible for yourself. How beautiful is that? That's beautiful.
Yeah, we can say happy recovery.
That's right.
What we can say.
That's right. Happy
Surgery
recovery.
in 2020.
Happy new life, right? Happy
there
new life. New path.
There you go. Awesome. Hey, Mary, we'll get to do this more often. This was fun. Thank you.
Very fun.
Wow. Yeah. And it's good to review. And there's so much we did not review. I would say browse through the blog, leaf through some of the podcasts that we've done. They're really evergreen in many cases. And we will, as Mary said, continue to put out the best information that we can. We view ourselves as educators and communicators, and there may be topics, for instance, that you have in mind that we haven't covered It's the Bees Knees Podcast at gmail.com. It's easy to reach out to us at any moment. We will personally respond and maybe pursue the topics that you'd like us to pursue, because that's what we do. And I am on the hunt right now for some other terrific speakers. I've got a good one starting in January coming up, but there are lots of marvelous people and talented people out there with whom we should be speaking for this podcast. So if you've got thoughts, please send them our way. Well, Mary, is that it? Are we done?
I think so. I think so. Thank you,
All
PJ.
Right. Thank you, Mary.
We'd like to thank a few friends of the Bees Knees podcast, including the Knee Pain Guru, natural solutions for chronic knee pain without drugs, shots, surgery, or painful physical therapy. For more info, visit thekneepainguru.com. We're also brought to you by X10 Therapy. And special thanks to Dr. Justin Trosclair at the podcast A Doctor's Perspective Podcast.
If you plan to go to China for business or pleasure, the main thing that you have to master is the dinner culture. Things like the lazy Susan, should you drink, how to use chopsticks, where am I supposed to sit, gaining and losing face. I'm Dr. Justin Trosclair, and after 5 years of working in China, I took all my knowledge and wrote a book about it. You can find it at adoctorsperspective.net/Chinabook and on Amazon. And while you're at it, take a listen to the podcast, adoctorsperspective.net, where I interview doctors of all specialties, talk about successes, marketing, struggles, and all those types of topics you don't normally hear.
The Knee Store. If you're having a knee done, you just may want to share that news with the world. If so, we've got a mug, t-shirt, or awesome tote for that. Visit the Knee Store on cafepress.com. Shop for the perfect item that reflects your feelings about getting back to a full life after a successful knee replacement surgery. Visit cafepress.com/the Knee Store. Great prices, fun and unique stuff.
The Bees Knees podcast comes to you from our studio in Lower Manhattan, New York City. We're here week in and week out, shedding light on all aspects of knee surgery and recovery. To reach us, send an email to thebeeskneespodcast@gmail.com.